For Ruth Kuhn, it was news that shook her to the core.
I did understand that I had a form of, somebody told me 2 forms of pneumonia, but the serious thing was an infection in the sac that holds the lung into place.
Ruth just turned 87 years old and is feeling great. But earlier this year, when she was admitted to the intensive care unit at Salinas Valley Memorial Hospital, her condition was grave.
They felt that I was going to die, the medical people.
A new program at Salinas Valley Memorial is helping patients like Ruth. It's palliative care, and it's designed to help those facing serious health conditions. Dr. Matthew Kadix is the director of the program, which is the first of its kind on the Central Coast.
Really, palliative medicine is for any time in a patient's life when they have a serious illness. So it could be for management of pain after maybe a spinal surgery, where someone's going to, really, they'll recover from this injury, but there needs to be assistance with managing that really acute, severe pain. But it could also be, someone who is facing a terminal illness and needs help with goal setting and management of extreme symptoms toward the end of their life.
While Ruth struggled with her condition, Dr. Kadix was there to help guide her treatment, a knowledgeable, comforting voice she came to depend on.
He was the man of the hour, whatever my hour was, and he would talk his way of talking, his voice itself, quiet, reassuring, kind, and he really meant what he was saying to me.
Palliative medicine is really patient-centered care that has 3 main domains. It focuses on the relief of suffering, communication between patients, doctors, and families, and it's a continuum and coordination of care across healthcare settings and really throughout the trajectory of a patient's illness.
During treatment, palliative medicine coordinates care among various members of the healthcare team.
It's going home, or a nursing home, or to hospice care, that we will help coordinate care across all those settings. We'll use all the different interdisciplinary services to provide benefit to the patients, which includes nursing, pharmacy, spiritual care, specialized supportive services such as acupuncture, aromatherapy, pet therapy, art therapy. So there's many ways that we can care for the patient in addition to the excellent technology that we have that focuses on the emotional and spiritual life of the patient.
For Ruth and many patients like her, the array of treatments and medications can be overwhelming. Dr. Kadix was there to provide information, and that helped Ruth with her anxiety, giving her more control over her healthcare decisions.
I'm thoroughly medicated, but he got through to me.
And Ruth made a choice, an informed decision based on the facts of her case.
I had to write everything, and when I communicated with anyone. And my son tells me that I actually even wrote that I was ready to go, to let me go. And I was ready, and I am an elderly person, and I had, whatever they had been doing, I didn't want any more of it. I was not afraid to die, and I was just trying to tell them it's okay.
Dr. Kadix respected her wishes, but before they removed her ventilator and feeding tube, he wanted one more conversation.
He'd asked me if I had any fear of any of what was going on with me, and I said, no, I feel no fear whatsoever, except I don't want to burden my children.
While she wasn't afraid, her will to live was perhaps far stronger than Ruth knew. With the ventilator removed, she began to breathe.
One of the nurses said, she's breathing on her own. And it went up and better from then on. It took several days before they decided I was going to definitely make it, and my vital signs were showing great improvement.
After 6 weeks in the hospital, Ruth was able to eat and talk again. She calls her recovery a miracle and credits her doctor and his palliative care with allowing it to happen.
I feel that he had everything to do with my actual coming out of it. Oh, Dr. Kadix is, he's tops in my book.
I definitely commend Salinas Valley Memorial for looking at the needs of their patients and understanding that this is something that needs to be integrated into healthcare.
I'm still amazed, and I still don't know what I was kept here for, but I'm sure it was for a reason.
At 87 years young, Ruth is now taking her driving test with the DMV, hoping she'll be able to run errands by herself again.
Illnesses most commonly treated by palliative care include heart disease, cancer, stroke, diabetes, renal disease, Parkinson's, and Alzheimer's.
Planning ahead is always a good idea when it comes to your own health care. If a serious illness or injury should occur, how would you want doctors to treat your condition? At Salinas Valley Memorial, your wishes matter, even if you're too sick or hurt to communicate. It's something you can prepare right now, called an Advanced Medical Directive. It's essentially a set of instructions on the kinds of medical treatments you'd want for yourself, and who, if anyone, you'd want making decisions for you. Leaving those kinds of choices up to an unprepared family can cause all sorts of problems. An Advanced Medical Directive puts the burden on you, saving your loved ones from the stress and guilt that comes with making such difficult decisions. Getting the Advanced Directive forms together is not hard. You do not need a lawyer, and it does not involve finances. We're just talking medical care. That's all. Call the volunteer service at Salinas Valley Memorial. They have all the information you'll need. They can also help you fill out the paperwork and walk you through the process.